So this is a collaboration I did with a colleague of mine, Rebecca Skinner from the Australian Stem Cell Centre, and two sociologists from Monash University. And what we actually approached this issue from two different, perspectives. Rebecca and I take a lot of inquiries, calls from the community asking about more information about stem cells, having read something in the paper, what does this mean, what does this mean to me, can I be a guinea pig, that kind of question. And what we noticed, certainly over the last couple of years, it's terrible echo on this microphone, isn't it? Terrible. The last couple of years, we've had more and more patients calling in who really wanted some advice around going overseas. So really following kind of on Ben's path there, wanting to try any option available. At the same time, our colleagues, Alan Peterson and Kate Sears, are sociologists and were interested in this kind of direct-to-consumer marketing, so the rise of the Dr. Google phenomena, the fact that we can now get a lot of information from the web, and at the click of a mouse we can find out a whole lot of stuff about what we're interested in, what it means, what a condition. But how do we filter that information? How do we analyse and interpret it? And anyway, we got together, and what we wanted to do was to go out into the community and interview people who'd taken the decision to go overseas, to capture their experience, not only the decision-making, why they went, but also what happened when they got back, and just give their journey some, respect. So we interviewed 16 patients. We got a small amount of money from the Department of Innovation to do the study, and we interviewed 16 patients in short 1-hour interviews. The people we interviewed were not only people suffering from a condition, but also the carers. About 9 of the people we interviewed were parents of children who they had taken overseas for stem cell treatment. And the conditions were spinal cord injury, MS, cerebral palsy, blindness. And all of the commonality with all these conditions were that they were using experimental stem cell treatments. So stem cell treatments that were available in India and China and in Germany that weren't recognised by sort of conventional medicine. And what I want to show you today is some quotes, sort of in their own words, some experiences of the patients, and kind of group them into 5 main themes, if you like. So the first one is, this is the document. It's very pretty. And it's not available on the website yet, but apparently the department are going to put it on their website soon, so I'll put something in the newsletter when it eventually happens. But the first issue we wanted to address was that there's an assumption that the people who are making these decisions are perhaps being seduced by the internet advertising. And what was very clear from the conversations we had were that the people who decide to go overseas do this after a lot of research. They believe they're very, very well informed, that they not only read the website information, but they go out and seek out people who've had the treatment and talk to them, talk about their experience. So they believe they're very well informed before they make this decision. I suppose what I found a bit concerning was they acknowledged that they sought medical advice, but that medical advice was usually at that clinic. So the clinic that was selling the treatments. They didn't really talk to their doctor about it, and this is something that we're quite interested in and would like to understand a bit more. The second point was why they travelled abroad. And again, it's probably not a surprise that a lot of people felt as though they were desperate, that there was no other choice. There was an enormous amount of anger that Australia had fallen behind the times, that because of our ethical and regulatory framework, that you couldn't do this work in Australia. So it's a kind of assumption that the work should be done here, should be delivered, not perhaps that it's at this early stage. And I think Kylie's comment, this outrage, kind of captures that. For the parents of children, there was also this concern that there was only a small window of opportunity, that if they didn't take their kids overseas now, then the stem cells won't work later. So there was this kind of, again, desperation and absolute need to do it now. This is an area I think is really interesting around risk-benefit analysis, and I think we touched on this before with one of the comments. And this again, the people we interviewed felt as though they had done this, they felt as though that they understood that the benefits weren't necessarily going to be miraculous cures. They could just be improvements in their condition. They didn't believe, they weren't expecting to walk away cured. But I think what was concerning is, again, summed up by Lisa's quote here, where the risk is perceived as being doing my money, losing my money, not necessarily an adverse health risk. So it goes back to some of the things Alan was raising before about first-in-man testing. If these clinics aren't sharing their results with the broader medical community, with their peers, how can we learn from these experiences? So I think it was really interesting that there wasn't really much discussion on risk in terms of adverse health event or adverse outcome. And again, Rick's quote here, this desperation, or this not desperation per se, but this feeling like you've got to get on with it. I can't wait 10 years until we do all the animal testing and then the testing in humans, then monitor them for 3 years and then make it up your mind. There was this feeling that you want to get in there now and have a go. Of course, the costs are high. The people we interviewed quoted between 10 to 40,000 per treatment. They were very keen to have multiple treatments. A couple of people had 3 or 4 treatments. The cost associated with the treatment, of course, doesn't necessarily include the accommodation and travel costs, not only for them but also for their loved one or their carer who's travelling with them. So there was a high financial cost, huge reliance on fundraising within the community to get that money. And I suppose that is an interesting point in itself. The other thing is the high emotional cost. So it wasn't just the financial cost, it was the fact that you might be overseas for quite a few months and away from loved ones and feeling disconnected from the community, isolated, I suppose. But the final point was everybody we interviewed said it worked for them in some way. They agreed that this doesn't necessarily mean an improvement in their physical condition. What it did was gave them hope. And this quote from Natalie, and I think it touches, and I also want to make a comment about when they came back to Australia, they didn't necessarily have their improvement medically verified. Sometimes the doctors weren't interested or weren't prepared to test them, which I think is a real mistake. I think we should be more open about someone's experience and treat it again with a bit more respect. But I think the great challenge, and certainly for me working in this area, trying to kind of contextualise breakthroughs in the science into something meaningful in the community and not overhyping it, is how do we maintain the hope in medical research and sort of like a legitimate pathway of discovery while getting information out. So I suppose that's kind of why we're here today. But I just wanted to share, we've heard about Ben's story, and I just wanted to share some results from our study. At the ASCC and now at Stem Cells Australia, we put out information in the community, and I've got some flyers here that we can hand out later. And this is a link to part of our website where you can download some more information on stem cells, what's available now, what do we hope to achieve in the future, and how do we get there? What's this clinical trial pathway and how does it work? If you're going to go overseas, and the whole document is built around giving the community information and letting the people in the community decide whether they go or not. But there's some questions there. If you're thinking about going overseas to pursue some of these experimental treatments, there's a couple of good things you should ask. And you should find out the information, and as Stephanie said this morning, discuss it with your doctor and make a fully informed but also a very overt choice.